Welcome to You Weekly, a brand new showcase on workers and labour movement, featuring you, your workplace and work-life harmony.
I would like to suggest that the insurance be more affordable and also affordable for me and for the elderly. It's very hard for the elderly to get insurance at the age of 62.
Terminal diseases, the diseases that older people are more prone to suffer from, I think the government should also try to cover that. We are in a prosperous state now. We don't have a problem with our economy is good. Our general standard of living is good. We should increase healthcare. We should do as much as we can for our aging population.
I think on the whole this is good. More support to a wider range of people. And I think people are getting long-term illnesses younger these days with the lifestyle. So this extended coverage would help especially people from the low-income group.
On You Weekly, the labour movement weighs in on the MediShield Life scheme and puts forward suggestions on how to shape this new compulsory lifelong insurance scheme to better benefit workers.
I think it's important to reflect the union's feedback. After all, we have engaged quite a sizable number of stakeholders in this. So it's important for us to reflect their views. In a sense, at least they know that we have heard their views, and it's important in this sense to make it known to them.
Ensuring healthcare is affordable and accessible, relevant and inclusive. These key concerns are at the heart of the labour movement's suggestions.
What we are proposing is that, yes, we do understand that for the 80 and above, they are likely to, the incidence of them going to the hospital could be higher, but we are also mindful that for this group, they are not likely to have more savings compared to the younger cohort. So therefore, we are actually urging that since we are now doing this review, can we not standardise the deductibles for the 81 and above to be aligned with those who are younger? We would suggest that for this to be really insurance that take care of big bills, why not we do further tiering? Because the whole recommendations here premise on giving the Singaporeans the peace of mind that if let's say the bills exceeding certain X dollars, can we further halve it to probably 3%? And for exceptionally large bills, whether the committee could also give a further tiering so that it can really reduce the financial strain on the individuals.
To further ensure that healthcare is affordable and accessible, the LM is also proposing to include more chronic outpatient treatments into MediShield Life and expand the standard drug list.
From the labour movement, we would want all the stakeholders to play their role. We would want the employers to really review the employer medical benefits. So that is something which we hope that they will take a critical look at the benefits that they are currently providing, ensure that there's lesser duplication, and take care of the workers. Then from the government, we will certainly also wish that they will take care of the Singaporeans, and therefore also take a critical review at this point in time to really see how we could really make this a national insurance scheme.
To ensure inclusiveness, NTUC encourages services buyers and customers to contribute towards the MediSave accounts of freelancers and the self-employed, and called upon the government to incentivise this initiative. They also highlighted the need to make sure pensioners with post-retirement medical benefits are not worse off when they come under MediShield Life.
On the one hand, yes, all these recommendations will certainly lead to some premium escalation. But on the other hand, we think it is useful for us to see how best we can make this a national insurance scheme that can actually give people the peace of mind. On the other hand, I think we should find ways and means to see how we could help the individual to actually accumulate their medicine.
These suggestions have been given to the MediShield Life Review Committee, which is gathering feedback from the ground before it makes its recommendation to the Ministry of Health. That's You Weekly. Join us again next time for more on what's happening in and around the labour movement.